So glad to have you back for the second half hour of the program. You know, your body is an amazing machine. Most people get 50 years or more of really pretty trouble-free performance until, well, things start to wear and tear and it slows us down. You know, hips, knees, shoulders, your spine, those all can become problem areas that in the worst cases, you have to go eventually get sawed apart and replaced, right, with a joint that's made of metal and plastic. But if you know someone who's considering that procedure, ring them up and get them on the phone and tell them to tune in, because there's a procedure that might just help you escape all of that and get you moving again. It's called Regenerative Medicine, and it's a treatment offered by Dr. Tom Lazoff, Dr. David Stensland, and Dr. Mark Zollman at Physical Medicine Consultants. And we have Dr. Lazoff in the studio with us this morning, 6 feet away. We're safe?
Safe.
We're safe.
Thank you for having me again.
Yeah, happy to have you here. What's the most important thing to know about this form of treatment?
Well, there are a lot. Actually, there's lots to know, but the important things to know is that it comes from your own body. We implant it and or inject it that same day. Relatively painless. I mean, there is some discomfort involved, but not terrible. And it can help, like you said, avoid any kind of, further surgical intervention down the road for a time. And jury's still out on the length of time, but we're hoping to get 5 to 10 years. Obviously, technology will change greatly in that time period, and so the longer you can starve off putting different parts in you as opposed to your own parts, that's the key.
Yeah, you bet. So this is not an injection to relieve pain by inserting some type of painkiller. What is it that we're injecting into the joint, the damaged tissues?
When we talk about stem cells, we're actually taking your own stem cells and placing them in the area to repair. So when you get hurt, your body tries to repair itself. And obviously, as we get a little bit older, that's a little bit more difficult. And with arthritis, for example, so we're taking the stem cells, putting them in an area, and helping the body repair itself, essentially. And it's not an immediate result. Mm-hmm. It's not like numbing medicine and steroid medicine or a cortisone shot. This takes a little bit of time, but in the long run, it doesn't destroy the joint lining. Like now studies are showing that some steroids and numbing medicine can destroy joints if over and over injected.
So you're harvesting the material out of the bone marrow, concentrating it, right?
Correct.
And then you're injecting these stem cells back into my joint where, some kind of black magic happens and they transform themselves into whatever's damaged in that joint?
Correct. So the stem cells are basically, they don't know what they want to be when they grow up.
Kind of blank slate.
Blank slate, hopefully genetically perfect, etc. And so you put those where they need to go. And typically in a body, those stem cells are kind of floating around and produced on a daily basis, but just not enough of them get to that area. So what you're doing is you're taking a stem cell and you're going into a knee, let's say, and you're saying you're going to become, or you're going to help regenerate or repair this cartilage.
And so what other tissues can it repair?
It can help repair, rotator cuff tears. It can help, like ligament tears. It can help. We do a lot of arthritis sort of treatment: knees, hips, shoulder arthritis, neck, back. We can inject into discs and little facet joints in the spine to help repair the damaged disc tissue.
Wow,
well.
It's really interesting technology, and we have on the phone with us 76-year-old Roger Collett from Elkhart, Indiana. He was a college athlete who suffered severe back pain, had seen doctors all over the country, and finally found relief when he got one of these injections, I think, from Dr. Lazoff, right? Roger, are you with us out there?
I'm with you, thank you, yes.
Tell me about how bad your pain was and how it was affecting your life.
I don't think your listeners want any more agony after being shut in for this period of time. But the pain was the point where I had to retire earlier. I had a successful business. I traveled throughout the country, but I couldn't sit. I couldn't sit longer than 3 or 4 minutes. The pain level, as people like to go from 1 to 10, was a 10. I couldn't drive to the supermarket a mile away and get out of the car. I needed a shopping cart, like a 4-postered cane. Wow. I couldn't, as an athlete, I couldn't shoot baskets anymore. I couldn't do my workouts. I couldn't ride bicycle. I was pretty much an invalid, and every morning I had to literally roll out of bed on the floor and crawl. I took 8 to 10 Advils a day. So the pain level was severe, and it was totally disability, my ability to function as a person, a husband, a grandfather, and a businessman. So I traveled all over, and ended up in Fort Wayne with another doctor, Robert Shugart, who said, like every other doc, I don't think we can do surgery on you, but I know some guys that really know their business, and I'd like you to refer to them. And so that's how I met Dr. Tom and Dr. Dave.
So tell me, Tom, where was his problem, and what did you do?
Most of his problem, from the regenerative medicine perspective, was his sacroiliac joints. So there are 2 little joints off to the side of the spine, or your pelvis, so to speak, and they were arthritic in Roger. And so that's where we first did diagnostic tests to make sure that's where the pain was coming from, and then proceeded with the stem cells.
So you harvested bone marrow and then concentrated that and re-injected it. Roger, how long after that treatment did it take for you to notice any results?
Well, before I get into that, what he just glossed over very quickly is the heart of why these guys are probably, in my opinion, one of the most successful in the United States, because I've been to allegedly the best of the best. And the time and patience that they took, I mean the entire staff, in evaluating me and going through the process, none of the other doctors, MRIs, surgeons found the exact point to where my problem was. And these doctors did. And so when they gave me the option for this, they didn't just say, okay, let's do it and let's go into surgery. They said, here, you study this for 6 months, and we're going to do a little more testing on you to be 100% sure. And that's how thorough they are. And I mean from the receptionist down to the recovery. And so when they did inject me, they gave me not a rosy outlook. It's going to be 2 or 3 weeks, and you're not going to experience much of anything. Well, why in the heck am I doing it? Well, because it's going to work. Be patient. And they were 100% accurate. I bugged their office staff incessantly for the first 3 weeks, and they said, patience, and they walked me through it. And after a month, I began to see some relief. And after 2 months, I could sit. I could perform functions. I could put my socks on. I could sit in meetings. And after 4 months, fast forwarding, I was back to a life I hadn't experienced since I was at Western Michigan playing sports.
Wow. That's pretty fantastic. How long ago was that?
Well, 2 years, this July 1st.
And how you doing still? Is it lasted?
These guys and what they do so well, I truly believe, because I've referred several of my athletic friends to them, and they are experiencing the same fantastic results, but they study each patient, and they grabbed me by the back of the neck and said, you think you're well, we're asking you to be patient for another month.
That's no lie, by the way.
They took my foot off the accelerator, and they said, this will continue to regenerate, it will continue to work, it will continue to rebuild, and they were 100% right.
Wow.
Since July of 2 years ago, I have not had one Advil in my body.
Wow.
I'm playing golf 36 holes a day. I'm walking, carrying my bag. I'm biking. I'm working out. I'm playing basketball with the grandkids. I get out of bed every morning like a normal 18-year-old. I mean, it's amazing, but if you follow what they say, it works. The process works, and the interesting part is that whole staff is dedicated to your particular problem, and they find it.
Well, Roger, thank you so much. You're 76 years old and still going strong. Gosh, what an example. I hope I can catch up with you.
He is the ideal star patient, although we had to, like he said, grab him by the back of the neck and hold him down because, he wanted that result right away. And that's an important point for people to know, is that you just have to wait. I mean, in some cases, it takes up to 3 to 6 months before you really start to notice, a big improvement.
All right, Roger, we're going to let you go. Thank you very much. Appreciate your calling in.
Thank you.
That's Roger Collett from Elkhart, Indiana. Successful outcome for him with this therapy. That's pretty great. That's got to feel great.
Oh, that's awesome. Yeah, and patients have to be dedicated, like Roger. I mean, it's a commitment. I mean, you've got to give it time, and that's the key. And abide by the restrictions and the rules that we put in place. And again, you can tell. I mean, he's fit. He's an athlete. Even at age 76, he probably could beat me running around the building.
I know he can beat me. All right, we're going to take a break, and on the other side of the half hour, this commercial break, we're going to be talking about PRP, platelet-rich plasma injections. Same thing, sort of in a different approach for different conditions. So if you've got pain and you're trying to get over that without using drugs or minimize your drug intake, well, here could be a treatment for you to learn more about, and you will, coming up next here on the HealthCall Live Radio Hour.
Now, back to health and wellness correspondent Lee Kelso.
And I am 6 feet away from Dr. Tom Lazoff from Physical Medicine Consultants, safe social distancing, practicing here in the studio. We're talking about using your own body's healing power to get you past all the pain and discomfort of worn and torn joints. We just talked a little bit about a stem cell process, but there's another element of that called platelet-rich plasma, PRP. Explain that to me.
Well, platelet-rich plasma, that's obviously coming from your blood. It's a blood draw, and again, it's processed to get the platelet-rich plasma out of the blood. And then we place that to help repair tissue as well. And so if somebody has, let's say, tendinitis, like tennis elbow or golfer's elbow, or bursitis, these are situations in which the PRP can be of benefit. What it does is it incites your body's own natural healing process. It recruits cells to growth factors. It recruits cells to come to that area that's not doing well. A lot of times if somebody comes in with tennis elbow, you give them a cortisone shot, and that may do the trick. And sometimes that's what we may try right off the bat, since it's less expensive and quick. But the PRP is the body's own natural way to heal the process.
So again, muscle tears, soft tissue injuries, this is what's effective for?
Yeah, mostly for those. But we also, like when we do stem cell injections, we'll then bring the patient back 6 weeks later and do kind of like a boost with platelet-rich plasma to kind of help continue to recruit the cells to that area.
And again, it takes it's a healing process, so you kind of have to give your body a break while it's working?
Correct. So let's say it's tennis elbow, then we will brace them for a while, like 3 to 6 weeks. They're not allowed to take any, whether stem cell or platelet-rich plasma, no anti-inflammatory medications 1 to 2 weeks before the procedure, and as long as possible after the procedure, because the non-steroidal anti-inflammatories like Motrin, Nuprin, ibuprofen will inhibit the body's own natural ability to heal.
Yeah, I get it. Is this what Tiger Woods had for his problem?
Correct. Tiger Woods, Rafael Nadal, they've had that.
So what's involved in determining whether or not I'm a good candidate for either of these procedures?
Well, when you evaluate the patient, so if I have somebody that's relatively old, more mature and maybe osteoporotic, and it's a knee joint arthritis problem, I'm probably going to go towards the platelet-rich plasma, because I don't really want to get bone marrow in somebody that's osteoporotic. But typically, if it's more of an inflammatory condition or a tendinitis, then we'll geared more towards the platelet-rich plasma. If it's more of a big tear or the arthritic conditions, then we'll go stem cell.
Hey, I feel I've neglected to include the audience here. If you have questions about this and whether or not what you're suffering might be a possible candidate for this form of treatment, phones are open. I just forgot to mention it. 800-333-1190, 447-1190, or you can send us a text at 46862. So let's talk about the other side of this, and that is, what's insurance coverage looking like for these procedures?
Most insurances do not cover. Occasionally, a workers' compensation carrier may cover. Sometimes it's included benefit in a healthcare plan, but it's rare. So it's mainly a cash-based procedure right now.
And what's behind that? Doesn't that drive you crazy? Something that could avoid surgery, get people back on the job, end that pain, and it's not covered? What's going on there?
Correct. I believe the FDA considers this right now investigational, not experimental, but investigational. And so far they've approved the process from the standpoint of harvesting on the same day, injecting on the same day, and minimally manipulating the products. So there are other techniques out there that they've kind of come down hard on, where the products are more than minimally manipulated, which means you're adding chemicals to them and stuff, and that's really not allowed.
And what's important, I think, about this treatment, as I understand from the research I've done, is because it's coming out of your own body, it's a lot more effective than if you are using cells harvested elsewhere or from other folks. Correct.
And when you're taking like umbilical cord products, then you are... They list those as stem cells, or some people promote them as stem cells. They're really not stem cells, because in the process and the process of cleaning or sterilizing, they kill those cells. So, by the time they're injected into you, they do have anti-inflammatory properties and some growth factor properties, but they're not really stem cells.
There's got to be a downside to this. It can't all be sunshine and rainbows. What am I missing here?
There's a little, I would say that there, it's not pain-free, but there's a little bit of discomfort, and you have to wait.
Yeah. So then while I'm waiting, after I've had the treatment, and I can't take any pain relievers for that period of time, so I've just got to gut it out.
There are things that we can give that won't interact with the process. And we've had a few cases where somebody's got terrible arthritis and they were really struggling, and we would then prescribe a different type of medication. It wouldn't be an anti-inflammatory; it'd be a different med to do.
So who do you think is going to have the best outcome? Describe for me the kind of pain I'm feeling or the type of problem I'm suffering that is likely to have a positive outcome.
Typically, it's going to be the 50 to 70-year-old individual who has arthritic knees, who wants to remain active, who doesn't want to have a knee replacement, who doesn't want to be laid up for that long period of time. Or somebody that is too young, in the 30s or 40s, that has, for whatever reasons, a little bit more advanced arthritis, who, if you put a new joint in them, they are going to most likely have to have that repeated second or third time down the road because they're so young. And so those would be the individuals, that would be ideal for the procedure.
So did I position it correctly? If I'm headed toward a joint replacement, I ought at least investigate this?
I would say yes. To be quite honest, there are times where people will come in and they will have, bone on bone in their knee, let's say, and I would just say, gosh, I'm not sure it would be of any, it'd be like flipping a coin whether it's going to work or not. But I would at least have that opinion, or get the opinion, so that you can make an informed decision before going forward with a more permanent process.
Yeah, I know these guys, and if you don't think you're going to be able to help people, you're going to tell them that up front. I know that about you. Let's talk just for a second about COVID and how that's affected the practice. So you're not, my gosh, you haven't been able to see patients for a while. Is that going to create a big backlog now?
Correct. Yes, we're incredibly backlogged. We have been doing telemedicine since this all went into effect. For a number of weeks now, obviously. We've chosen one of the younger partners in the group to do more of any kind of emergent interventional procedures for injections and things. So we've taken a hiatus from stem cell because that's not really emergent, and a lot of other things right now. So yeah, it's been tough. And to do things over the phone with patients is a lot more tricky than I thought.
So folks with, a horrible back in need of a steroid injection for that pain relief, they've been kind of just in the cold. That's kind of tough.
Correct. I mean, if they're about ready to go to the emergency room, we would want to get in. Then we'd say, okay, let's get you in to inject you because that'll save you a trip to the ER, which you really don't want to do right now anyway.
Yeah. Okay.
So every case is different. But yeah, the volume is incredibly down right now and building up at the same time.
So if I want to explore either stem cell or platelet-rich plasma injection to relieve my joint discomfort, how soon are you going to be able to see me?
We are starting to put into place a process so that we can have more patients in the office. So probably not this coming week, but the following week we're going to start gradually, and it depends what the governor says as well. But maybe the following week.
All right. So I guess the message there is get on the phone and get on the book so you can get that appointment scheduled. Thank you very much. That's Dr. Tom Lazoff from Physical Medicine Consultants. You can find more at pmcrestore.com. Again, that's pmcrestore.com. And we're back again next week with the HealthCall Live Radio Hour on WOWO.